Welcome to the Therapeutic Food Solutions podcast. I'm your host, Marian Mitchell. I'm an integrative nutrition health coach, therapeutic diet expert, and founder of The Road to Living Whole. There are many different diets out there. It's hard to know which one is right for you with your chronic illness and autoimmune disease. In this podcast, I'm going to share with you the foundational pieces every single therapeutic diet out there shares, and also how to use the best one for your particular diagnosis. If you've been looking for a meal planning partner, help navigating the complicated healthcare system, and want to feel better quickly, I'm your girl. Grab your kombucha and notebook. Let's dive in. Hey everyone, welcome back to the podcast. I'm so excited for today's guest. His name is Mark Durante, and he has gone from a heart transplant to starting a regenerative therapies company. His story is really interesting. It's inspiring. I really think that you are going to walk away. His goal is to make sure you know what questions to ask your doctor to get what you need. But through that, we're going to learn about his story and where the Heart of Rise Up is, what therapies they offer, and just a ton of really helpful information. So I'm really, really excited. Mark, welcome to the podcast.
Well, thank you so much, Marian. I am so grateful to be here. And I actually loved how you started out the Heart of Rise Up. Like, I haven't even said that, and I've had the company for all these years. So I'm gonna take that from you if you don't mind.
Don't mind at all, because I do. You were giving me kind of an overview, and really this comes from your heart, and not just, your physical heart, but your passion. Correct. And I'm really excited about what you're doing. So I'm just excited for us to dive in. But let's talk about your story, because you come from chronic illness, and this is what has, this new life that you have you've chosen to give to others through it. So I think that people need hope. And I think that your story is going to inspire a lot of that. So let's hear your story.
Well, thank you. Yeah, as a matter of fact, I'll kind of set the stage because I'm about to become 53. And this story started to take place when I was 35. Mm-hmm. And a lot of it is that, I was an athlete when I was younger. I just kind of was going through life. I was trying to keep in good shape. And then one day I start losing feeling in my toes. And this was like around 35. And I remember it very clearly because I'm on a treadmill and I'm running, and all of a sudden I can't feel certain parts of my feet right away. And you dismiss it, right? Mm-hmm. But then as time goes on, those nerves continue to further die and die and die. And I would probably say that right around the age of 40, I started to really lose a big function. And I want to say lost function in my feet. I could walk fine, but the pain was extreme. And I was running around from practitioner to practitioner trying to figure out what was causing this neuropathy that nobody could explain, because I wasn't a diabetic. We did genetic testing. There was nothing in my genes that would say that I should be expressing any type of neuropathy. And I was actually going to, one of my friends was working with a vascular surgeon who said, we might want to check you for peripheral vascular disease. And so when I went in there and started going through the exam, he goes, I hear this irregular heartbeat. And I'm like, well, I'm not really worried about that. Everybody in my family has an irregular heartbeat. And he's like, yeah. But he said, to be honest with you, right now at your age, by that time I was around 40 years old, we should probably just kind of take a look at this, maybe go see a cardiologist, get a baseline, let them follow you over the course of life to make sure that that irregular heartbeat stays the way it should. And so I'm like, all right, I'll do it. You're a friend, you're a nice guy. Let's, let me walk through this with you. So I went and actually saw a cardiologist to get my baseline. And what was very interesting about this story is when I go in order to do the testing, the room was actually taken up by somebody to do the third part of the test, which was probably the most important test. So we go through, do the first two phases. I'm talking to him. He goes, look, that heartbeat is going to be fine. You could live an entire life like this. I do see some abnormalities, but nothing that I would be too worried about. And it just so happened as I was walking out his door, there was a proverb that was up on the wall, and I just stopped and I'm like, I found it very interesting. And I started to ask him a question about it when all of a sudden the lady comes out of the room and says, hey, we just had a cancellation. Mark, since you live an hour away, would you like to go ahead and do the final the third part of the test? And I said, sure. I'm here. Let's do it. So we go back there. And of course, the crazy part about this is I'm just trying to be jovial through the whole thing. She's on there looking at all the parts of my heart. And I'm like, hey, look, I just want to let you know, a lot of people tell me I've got a big heart. She just looks at me like sternly and goes, Mark, that's not funny in this office because an enlarged heart is actually a health issue.
Right.
Of course, at the time, I'm like going, oh my goodness, it is. So, we go through that part of the exam and he has me wait there for a second as he reads the report and he pulls me back and he is white as a ghost. And I'm like sitting down there and I'm like, what's wrong? He goes, well, I need to talk to you about a couple of things, but he kept hesitating, like he was struggling to spit it out. And I just said, look, tell me. I can handle anything. I'd just rather you tell me so I can kind of wrap my mind around it. And I've heard some of your podcasts where you're talking about the mental well-being. It was important, right?
Yeah.
And so he goes, well, your heart is functioning at 50% function. I actually want to send you to a doctor at Baylor Scott and White in Dallas to evaluate you for a heart transplant. And I'm like, what?
Whoa.
A heart transplant? So I will just say this for any of those that are going through these sort of illnesses, when you get hit with something like this, you think you're handling it pretty good. But I tell everybody, I said, I walked out of that hospital that day. I could have walked out on a highway and didn't know it. Like your just mind is off into 100 different locations. And before I even knew what I was doing, I'm standing in the middle of the street and I'm like, oh my goodness, like I could have been hit, but you're just so phased out. Well, anyway, long story short, I go see the heart transplant cardiologist, and she goes, we have a lot of people that will come in at this phase and they won't need a heart transplant. You could live an entire life and never deal with anything. We'll manage you with medication and we'll see how things go. So fast forward 3 years later, all of a sudden, one day I'm walking into an office. Now I'm a medical salesperson at that point. I'm walking in order to see a plastic surgeon. And all of a sudden my voice just starts like getting raspy, almost like I was like brand new to the industry. By this time I'd already been in it for 18 years. And I'm talking like it's my first day on the job that I never knew anything. And I was shocked by this. Well, I went home and that night I suddenly woke up and couldn't breathe. And I called my ex-wife at the time and I said, hey, can I get your help? I need you to drive me down to Baylor Scott and White in Dallas so I can see my transplant team. And of course, I didn't have a transplant team at that point. It was just, I knew if I was going to have something done, that's where I wanted to be.
Right.
And she drove me down there. They did a test and they looked at me and they said, Mark, your ejection fraction, and that's the pressure at which your heart is pumping out blood, is at 5%. He goes, I don't know how you're talking to me right now. And I certainly don't know how you walked in. And you're also in the middle of a heart event. And so he goes, we are submitting you for transplant immediately. And so I wound up going through and, meeting with the transplant team that day. But it turns out I'm an O negative blood type. So O negative is getting a O negative type heart is rare because it's in so much in demand.
Mm-hmm.
And they're like, it's going to take you 4 months. You won't make it past a month. You'll be dead. And so they said, we want to do a procedure that we've been using for a lot of people called an LVAD, which is called a left ventricle assist device. Basically, they do an open heart surgery. They tie in kind of like equipment into your heart. If this gives anybody a perspective, they drill out the bottom of your heart and put in and attach a pump into it. And it basically helps the left ventricle pull blood through and assist the rest of the body for getting blood flow.
Mm-hmm.
So I wound up going through that. I wound up going through two of them. Then in that 9-month journey, I finally am sitting in the hospital on my birthday because something was going wrong with my blood work. And they're like, we're going to have to keep you here either until you die or till we find you a heart. And so that's not the last place you want to be is in a hospital to experience your death. And what's very interesting about it is God has a funny way of doing things because literally he took me up to the last days. I mean, I was having end of life discussions in the hospital about 25 days after being in the hospital because my heart was getting so erratic. And I had to make a choice on going towards a more compromised heart. So they've got the good pool, and then they have the pool we need to go to because you're not going to make it, and anything will do type pool.
Mm-hmm.
And so, but before I could answer that, I wound up actually having a heart come through the next day. And then voila, I started off on my journey of kind of return. However, we thought the neuropathy would go away. Instead, the neuropathy got worse. So bad, I lost feeling in my feet and halfway up my legs. I couldn't feel the foot pedal underneath of me. I'm living on my own. I'm still in a medical career. I'd been through every drug trial that they had trying to find a medication that works. And then all of a sudden, I'm on such mass dose of medication. Insurance didn't even want to pay to have it upped.
Mm-hmm.
And when I say mass doses of medication, at the final, They were doing 675 milligrams of Lyrica, trying to find a way with insurance to take that up, tramadol and hydrocodone to supplement pain.
Hmm.
I couldn't bear it. If I were to go to exercise, and I always would try, it would take me 3 days to recover. It was so bad. So it is, it just so happened that because of all those doses of medication, I'm like, I don't know how I'm functioning as a medical person going in and talking to medical practitioners about this. I was getting scared that they would kind of start to recognize that maybe I was slowing in my speech, slowing in my thought. So I was actually looking at going towards long-term disability, because the pain was so extreme. And I just remember too, one day sitting on the couch and I was like, God, is this some sort of sick joke? Like, you would survive me through a heart transplant. You could have taken me and you didn't. And instead you left me with this debilitating disease that is going to have me rot for the rest of my life, sitting here on the couch watching Netflix and just being, hopped up on medication the whole time. But what's interesting about it is I was working with this orthopedic. We were working on a project that was designed for aesthetic applications, but we saw an application for more the functional longevity side. And we were sitting down on a discussion one day, and I really in a desperation because I felt like I had the connection with him. I could talk. I told him my story about the neuropathy, and he's like, Mark, he goes, you shouldn't have to suffer like this. Like, I've been doing stem cell research for 20 years. He goes, I can do things for you that can actually restart your journey for you. If I can't get you 100% better, I can get you part of the way. And so I would just say this, when somebody gives you that kind of hope, it's like, okay, I will empty my bank account in order to make sure that. Now, granted, he did not have me do that. He was very gracious in trying to help me get back there. But the thought process is this: you'll do anything and pay anything in order to get any element of hope to reduce all this pain. So long story short, I went through it with him and I got about 50% of the way better. And then what I found is that I was incrementally spending the same amount of money to get almost no additional benefits.
Hmm.
And, here's the thing. It's part of why I do what I do, because at that point, when you feel like, hey, I got 50% better, there's got to be another solution. Maybe he doesn't have it. There's got to be
Hmm.
another way. I wound up getting connected with a company who was doing studies, and their lead investigator was a heart transplant cardiologist at Cedars-Sinai. And so I wound up starting to use the product that they were using in some of their neurological and orthopedic studies, and it got me off 100% of my medication.
That's
And at that point,
amazing.
oh, absolutely, absolutely. And at that point, I'm like sitting down there and going, I've been in medicine for 18 years and didn't even know that these were options. How does the rest of the world know this? Because we're all suffering, you know?
Yeah.
So it is, so as I went through this, I decided that I was going to start a company called Rise Up Medical. And you and I kind of talked about the fact that, the rise up kind of came as a three-factor part, where one was an element of faith, but one was an element of, when you're going through a heart transplant, you're literally going under, in my ideas, of dying and then coming back, right, with a new
Hmm.
heart. And then the third one is taking this experience in order to elevate others or help them rise above their extreme circumstances. So this became a passion project and a legacy project. And the beautiful part is where we are in regenerative medicine. This will last. I could walk from project to project to project and never leave this field and have something that could create change for everybody for the rest of my life. And and
That's
and like, yeah, go ahead.
that's an incredible story. And I also think that it's one that many people in the chronic illness world experience is, you finally find out the problem and
Mhm.
they give you a solution, you got your new heart, but then things weren't better and it
Correct.
almost got worse. And
Correct.
I mean, I can only imagine that your faith got you through it.
Oh yeah, that has to play a serious part.
And then the people that God put in your life to help you and the plant the seed of just share your story and see what
Correct.
happens. Now, my question is, now that you are in this world and in
Hmm.
regenerative therapies, along with the stem cells, can you share the other therapy that got you the rest of the way, or multiple therapies?
Yeah, so and I'll be honest with you, there's a lot of different ones, so we can do things, and there's a lot of different ones, because I mean, you and I talked about kind of like red light, and we talked
Mm-hmm.
about ozone therapy, we've talked about hyperbaric oxygen. Like, these things are all playing key roles in the therapy. Now, and I think it's important to state here as well, I'm never telling anybody that these acellular stem cells or stem cell derivative products are going to be your only route to health. It played a significant part. And the reason why I look at this, and I kind of give it from the story of when you go into an IV clinic, you're trying to get a large infusion of something into your body, correct?
Mm-hmm.
So something that your body doesn't have to go through the digestive tract, right in the bloodstream, can start working everywhere. But
Yeah.
that doesn't mean that you don't go home and have to take supplementation in order to keep everything elevated. So
Right.
it's really a two-tiered, you know? And so when you look at this, I may have done a lot of these type of therapies, but I always supplemented them with other things because, as you know, with chronic illnesses, they can be parasites, they can be abnormal gene expressions, they can be all kinds of different things that are playing in the body. And so you have to
Yeah.
find out which therapy is going to work best. Because, like, if you got a parasitic issue or a microbiome issue that's causing a lot of your chronic issues, stem cells aren't going to play the part first. Like, you've got to
Yeah.
get the microbiome under control. Then you can use the stem cell side to repair.
Yeah. So what I'm hearing is regenerative therapies are helpful and beneficial, but they won't do the work that lifestyle and diet will do. So you have to be eating in a way that nourishes your cells and gives them what they need. You have to be taking care of yourself by sleeping. You have to manage your stress
Yes. I
and
mean,
all of
it's
that.
if people saw the therapies that I did for myself, you know, and it wasn't to get to where I was. It's what we're doing to maintain, right? Because I don't
Right.
have to do the same amount of, you know, stem cell therapy anymore that I used to. But now I'm doing small things constantly, right?
Yeah.
It's the one thing too that if you're speaking to the younger person, if you start these sort of things now, you will save yourself the cost of spending what I spend today to try and maintain youth. But I will
Yeah.
say this, I feel reversed in age. Like I don't feel 53 at all,
Well, you don't
at
look
all.
53 either.
Well, thank you, thank you, thank you. It's I appreciate that. It is and I really give it up because I do things like peptide therapy. I do,
Mm,
you know, the exosomes and the acellular stem cells. I'm doing the ozone, like we talked about. I'm a believer in, you know, red light. As a matter of fact, it's funny. I was doing red light therapy before it was popular, and now all of a sudden it's the craze. And I'm like,
yeah.
man, I wish you guys all loved it as much as I did like 10 years ago.
Yeah. Well, and what's interesting is, I think what's hard in the chronic illness world is like there's like these trends that these influencers and
Correct.
doctors get on. You know, I mean, even I do this. I get on to something that I think is really powerful, and I would talk about it a lot, right?
Yes.
And it's like red light therapy is like the big thing right now. My concern is
Correct.
like the at home stuff. Is it as medical grade? Is it actually at therapeutic levels that it's actually going to do something?
Right.
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 Because I actually talked with a guy who has a red light therapy,
Correct.
whole
Correct.
body thing. Like he talks about how therapeutic it can be, and it's like his is
Correct.
like a therapeutic level, and then it's like, are these at home ones even more powerful enough to maintain? Right.
Correct.
And then it's like,
Correct.
well, you can get red lights therapy from watching the sunrise and the sunset. And, so
Yes.
it's like, this idea of therapeutic level versus maintenance
Correct.
level, right?
Correct.
And when you're in the thick of some debilitating symptoms, you need those
Mhm.
therapeutic things, but people don't even know what their options are.
Correct.
Like
Correct.
exosomes. So I have an office here locally that I go to once a week and I work out of. Like they do all kinds of, it's a med spa. And so
Yes.
like,
Okay.
I
Perfect.
didn't learn about exosomes until they did some treatment on me that my face swelled like a chipmunk, but I had to apply them every day for a week, right? And
Yes.
it sped up the
Yes.
healing, and there were no scars and all of this
Correct.
stuff. So it's like, but I'm like, I don't even know what that is. And then I only know it in the context of it's good for your skin, right?
Correct.
So it's like
Correct.
there's all these therapies out there, but people don't know how to talk to their doctors about it. They don't even know what
That's
their
correct.
options are. And so with Rise Up, do you so I guess my question is, are you able to help guide people in that to even know what their options are? And then what questions to ask their doctors?
Yeah. So, you know, I think a lot of it too is biologics are complex conversations, right? So a lot of it is trying to create simple analogies that will give people an idea of what an exosome is, right?
Mm-hmm.
It is,
Right.
when we'll just take the example because you brought up exosome. You know, when I try to give people the example of an exosome, it's really a carrier vehicle. And I will kind of take it like from the example of Imagine having a grocery bag. That's an exosome, right? There's nothing
Mhm.
in it at that point. But what happens is what you put in it, fruits and vegetables and all that sort of stuff, how you get it from the grocery store and get it to your house in order to be used, that's what an exosome does. It's a carrier vehicle of high level nutrition from one cell to another. So your cells are a manufacturing facility, and they're
Right.
making proteins all the time. The key is that they're in a community of sharing. So what they want to do is how do they take what they've built and then give it to other cells that could be utilized in order to repair themselves? So like when you talk about, you went through this one case where they did a procedure and you're swelled up like a chipmunk. Well, one of the things is that that was an inflammatory response, right? So the
Right.
first thing you need to do is how do you calm your immune system down? Well, some of the things that they pack in that grocery bag are anti-inflammatory proteins that will go in and help calm the immune system so it doesn't overreact. That way, now, once it's calm, the body can truly come in and repair without being fought. It's kind of like I tell everybody, it's kind of like somebody shooting Nerf guns at you while you're on a scaffolding trying to build something versus just being able to lay brick with no obstacles whatsoever, right? It's like
Yeah.
that's the difference. And so exosomes are packed with those great anti-inflammatory proteins, but they also have the reparative. They have the bricks and the mortar in order to do the repair process. And that's just
Awesome.
that's just one example because when you
Right.
look at a stem cell is the total manufacturing facility, right?
Yeah.
So a lot of times when I tell people, about the difference between a stem cell and an exosome, I will tell them a stem cell is like going to a buffet and pulling the entire buffet to your table. An exosome is like you and five of your friends grabbing a plate and putting as much on that plate as you can and then taking it back in order to share with one another.
Okay.
It's vastly different in terms of what's available. So when you're dealing with more chronic related issues, exosomes can be good, but I find exosomes really good more for acute related cases
Okay.
where the acellular stem cells are good for more chronic related cases. And I saw this because I've tried to use exosomes even for my a lot of my own issues. What people don't realize the amount that you'd have to pour into the body in order to get that kind of benefit, it's almost unaffordable. But if
Yeah.
you could grab all the proteins of that stem cell, it can play a major role. Now, I'm sure some people would debate me on some of these elements. And when I say that is because exosomes are becoming very popular because they're less expensive to bring to market to be able to give to patients. And they play great roles in wellness, and they play a great thing in prevention and longevity. They play a great thing in kind of immediate healing, particularly with skin. But when you're dealing with a lot of chronic stuff, we always have to remember the patient comes with a budget. So if we're going to do this, we want to give them the biggest bang for their buck. And that's where I'm at that point trying to say, this is where you're going to make a choice between one versus the other. And, even in my own learning experience, I had to be able to sit down there and have this conversation with practitioners because they're trying to understand them as well.
Right.
And where they apply. So there's a lot of cool applications. We just have to line up the right biologics because a lot of people are familiar with PRP.
Hmm.
So PRP is where they were extracting your own blood. They were pulling down all these real specific platelets that play a big area in repair. The thing that they realized over the course of time is that PRP is not created equal between person because one person could be completely healthy and young, the other person could be having chronic illness and more aged or more mature. Their PRP and what you're pulling from their body is not going to have the same impact. And so some people with PRP didn't get any results, while others got great results. And what's happening there? Well,
Hmm.
exosomes kind of came in and got really popular because they balanced the playing field. Didn't make a
Okay.
difference who got them, the aged or the younger. They still played the same role because they carried equal contents regardless of health. So it is, and it's good. It's important to say that exosomes, a lot of where they're coming from, is we call them day zero cells. There's a specific stem cell called a mesenchymal stem cell that produces these type of exosomes that we get from donated placenta and umbilical cord tissue. Because it has
Ah.
not been influenced and it carries the greatest biological ingredients or molecules that will create life, it plays the best role in terms of helping with a lot of these type of issues. Now,
How
there's a lot of
cool.
places you can get these stem cells. You can get them from umbilical cord, you can get them from placental-based tissue, you can get them from bone marrow from your own self, you can get them from fat from self, but they all have a hierarchy, right? And so as we're playing in this space, we're just trying to figure out what hierarchy, what do you need and what hierarchy do we have to play with in order to get you the result. So That's
Interesting.
yeah, that's just a quick summary of,
Yeah.
it's
I think I'm going to have you come back and we can dive into things a little bit more specifically because there's so much out there.
yes.
So these things that are like the regenerative therapies that you guys specialize in,
Mhm.
is it stem cells and the exosomes? Is it the red light therapy? I guess it's
Yes.
just it's ever
No, no,
growing, right? Because
it
science is
is.
ever evolving. So if somebody is dealing with I'm a huge fan of ozone therapy.
Oh, yes.
I have seen some miracles from topical bag applications where you just sit in a bag. I've experienced it with blood and IV
Yes.
therapy. I've heard some amazing things for cancer and, like
Oh, yeah.
there's a lot out there. And I think what's people again don't know what to ask, and then also I think the cost scares them because an
Hmm.
ozone IV is like 350 $450, and they recommend them like every week for a while. And
Correct. Correct.
and same, I'm a big fan of IV therapy, and again it is one of those things like when people's guts are so compromised or they're so highly inflamed, I'm like, IVs are probably going to be worth the, thousand, $1,200
Correct.
just to get your levels up. And then also work on healing your gut, which is where peptides can come in because they can help speed that
Yes.
process up.
Yes. Yes.
And I've the world of peptides is so new to me and it's absolutely fascinating, but it's been around for like 50 years.
Oh yeah. Oh yeah. And one of the big ones for people, or particularly dealing with gut related issues, is BPC 157 in an oral form.
I've been seeing
So
commercials for it
yes.
on
Yes.
Instagram, like in the last like two
Correct.
weeks, and I'm like, hey, I know that one. But
Yes.
it's so interesting to be seeing commercials for it because I'm like, that's a peptide, right?
It
Like,
is. It is a peptide, and it's actually something that's natural, already found in your body, and it's in the gastric juices. The thing that I always try to express to people about BPC 157 is that, if you're having gut related issues, the oral is the best. But if you're trying to do for overall body, it gets destroyed in the gut. So that's why a lot of practitioners are having them doing an injection, not an IV,
mhm,
but just in a
right.
sub-Q injection,
Hmm.
is so that it has an impact on the rest of the body. So a lot of things too, just to give like a quick support to everybody listening, is peptides are very small and fragile type amino acid chains. And so what happens is they can be broken down easily. Just shaking them could actually break them apart and make them ineffective. A lot of people don't realize that. If you ever watch somebody truly doing peptides, they'll be rolling, their
Hmm.
vials in order to keep them protected. So in doing stuff, taking things in an oral where those gastric juices are going to break things down in a very aggressive fashion doesn't really award a lot of these peptides unless they're in some sort of liposomal support to get past the digestive tract, and a lot of it gets wasted on the gut. So
Yeah.
if you don't have gut related issues, it's important to talk to your practitioners about other ways to get those peptides in your body that have great benefit. And I do them all the time. Like my wife jokes, she's like, "How many times do you stick yourself a day?" And I'm like, "Twice, sweetheart, but how many I put into the syringe, that's the magic number you should be asking me."
Yeah, and there's several different peptides out there
Oh,
that
there's a lot.
yeah, that can do different things. I know some kind of tickle the hypothalamus, some,
Hmm.
and what's nice about them is if the body doesn't need it, it can turn it off. Where some other
That's correct.
therapies, you cannot
That's
do
correct.
that. But they are so new that they're actually pretty hard to find.
Yes. Yeah. Well, and you know what, too? It is a lot of people don't realize, but Ozempic and Mounjaro and a lot of these, they're peptides.
Hmm.
They've just been studied by the pharmaceutical companies and they've been patented. And so there's a name brand to them, but it's a peptide.
Yeah.
So it is, and it's basically all that peptides do is signal the cells on what they want, what they should be doing. Because a lot of times these signals get turned off as we age,
Yeah.
or just take gut
Illness,
related issues.
inflammation.
Yeah,
Yeah.
illness, inflammation, stuff like that. They're basically suppressing certain cellular activity. So all that you're doing with a peptide is saying, hey, I want this signal to go to that cell, tell it what to do, and then it starts producing, and all of a sudden the body starts to rebalance itself and starts getting optimized. So peptides are fantastic, but I tell people as well, like somebody will look at it and hear a story where I put a peptide in my shoulder and my shoulder suddenly healed. Well, I'm like, well, maybe there was a specific type of injury that made sense, but that is not the case because, like, even for myself, I have an injured shoulder. I literally did peptides in my shoulder in order to bring the pain level down so that I could sleep at night, but I still had to do a biologics therapy in order to restore the shoulder because the peptide wasn't enough. So I think part of it too is that we're so used to hearing all these crazy stories. It healed my cat and my horse, and I just gave them one dose. And you're like, okay, now that's not true. It, some of that's marketing, but the reality is they're powerful. If used correctly, they can make unbelievable change in the body, and they play a role with other
Yeah.
biologics. So it's we're just kind of, I call them the specialists of biologics.
Yeah.
It,
So if somebody wanted to get into these regenerative therapies, I think the biggest question is, or the biggest thing that people struggle with is asking the right questions.
mhm,
Doctors have, unfortunately, I'm not trying to offend anybody, but there are people out there that practice
mhm,
medicine who have very fragile egos and don't like
mhm.
being questioned. They
Right.
also don't like being told what to do. So, like, for example, my dad was really struggling. I'm like, you should really get your vitamin D levels checked. You should get your testosterone looked at.
Hmm.
I'd also kind of maybe look at your iron and this. And so he went to his doctor and was like, hey, I'd like to get these tested. And the doctor was like, nope, won't do it. And
Correct.
so it's like
Correct.
he ended up changing doctors because of that. But like the struggle is very real, and a lot of times it's we don't even know what to ask or
Hmm.
what we're looking for. We hear about something and we don't know how to ask to find it. So do you have any advice for people who want to, okay, I'm struggling and the foundation, I'm doing the foundations and I'm not getting to where I need to. I'm like 50% there, 60%
Yeah, yeah,
there,
yeah, yeah.
and I
Well, you
need
know
that
what?
extra.
I kind of I think of it in this terms as doctors are like pastors. You got to go to the one that speaks to you, right?
Yeah.
It is, and that's the thing is it's not that they're bad. Maybe they're isolated in one particular area. Maybe they don't have the same bedside manner that you're used to. I mean, that bedside manner that doesn't work for you works for someone else.
Yeah.
So in doing so, to your point, it's one of the reasons why it's as much an interview process for you as it is the physician when you're going there. If you don't like the answer, trust me, there's somebody that will get you the answer that you need. Now, when I say that, we do get patients that walk in and they want a specific answer, like, I want this done. And they'll go to every doctor in the world and they'll tell them, no, that's not possible. You should listen to that. But I'm saying this is that if you want to kind of go in and do labs and you want to check to see, hey, do I need a little bit more vitamin D? To your point, would peptides or exosomes or PRP, would any of these things be valuable to me if I do the right diagnostics? Yes, I would push that because, if you talk to a regenerative medicine doctor or a functional wellness practitioner, they will do those things because the guidelines which they follow are more broad than the traditional physician. It's kind of like in the medical community, there's a set of lab values that are just, hey, if you're here, you're good. And then all of a sudden, it's kind of like when somebody comes to you and says, well, your blood pressure is 135 over 85. Well, you're 50. That's okay. That's not the blood pressure I want. I want my, 120 over 70, right? Or
Mm-hmm.
72. It is so, part of staying young is not accepting old. And so that's why I would say is that when you go to a regenerative medicine, the intent there is to help in age management or to reverse that process. So what they're looking at is a more broader scale to go, yeah, actually you are a little bit outside. Maybe your testosterone's off, maybe your estrogen or progesterone are off, and they're causing you some issues. In the traditional manner, you would look at as, yeah, you're right where you should be, but you're suffering. And you're like,
Yeah.
no, I want to talk to somebody who has a little bit more broader scope. And that's who you find. You just said the word med spa.
Yeah.
A lot of med spas are aligning, they've got medical practitioners in there. They understand the wellness and longevity journey. So they're
Yeah.
going down that route. Not every med spa is doing it, but if you find one that does and they can start doing some of that diagnostic work, they're going to dig down in terms of finding your issues. I oftentimes have practitioners that I send people to when their physicians have failed or
Yeah.
the scope is too narrow. It is,
Yeah.
and again, medicine is harsh. I never want this to feel hard on any practitioners out there because if you saw the way they have to work, you understand why a lot of them don't have time to do some of this research. A lot of doctors are leaving the traditional medicine to get their time back to do this kind of study
Yeah.
so that they can actually offer these type of therapies, while the other one is being pressured by managed care to just churn, and they're just trying to keep up. So
Yeah.
it is.
The
And hey, look,
insurance model is destroying medicine.
it
And,
is. It is.
and we are lucky enough. I think physicians are lucky enough to be able to if they can figure out how to make the time to study, right? Like functional
Correct.
medicine doctors or medical doctors, they went to medical school, they did their residency, they've graduated, they are MDs. And then they basically go back to school and get an additional 1,200 hours of nutrition and
Hmm.
root cause medicine and
Correct.
alternative medicine education. And so they understand both models.
Yes.
And, and then there's naturopathic doctors. And if they go to a naturopathic medical school, they go through medical school, but they also have that additional 1,200 hours at the same time. They still go through a
Correct.
residency and all of that. And and again, we were talking about this before we got started. Naturopathic doctors, because they have just a broader scope that they can look at, but they also don't focus on what's in the normal range. If you're feeling off, they know what the optimal numbers are, which is
Correct.
much more narrow. And if you're not within that optimal range, they're willing to give the body a nudge to kind of help
Correct.
give it what it needs to go back to that optimal range. And that's where people, I think, where I love the naturopathic and the integrative world is what I
Correct.
call it,
Correct.
is
Yep.
because allopathic medicine absolutely has its place. There are
Correct.
times when pharmaceuticals are absolutely necessary. If I break my leg, fix it. I will detox from medications later. If I need a heart
Yes.
transplant, give me a heart transplant. Like
Correct.
it's not an all or nothing, which I think a lot of people tend to fall into, but it's really just there's different tools in the toolbox. And for chronic illness, the integrative world has way more tools in their toolbox, including these regenerative
Correct.
therapies. There's going to be some that are more sports medicine related that do more of the PRP and things
Yes.
like that. And then there's going to be some that, the regenerative or integrative ones that are going to do more of the red light and the ozone and the
Correct.
peptides. And the great thing is as doctors learn that there's more tools available, the more tools they have in their toolbox, and
That's
just
right.
the better it is for the patient. I think the downside of it being so new is that the cost is there. And,
Correct.
when people have been going to doctors for 5 to 7 years and they've been promised things and it's failed or it hasn't delivered, it gets overwhelming.
Well, and they lose hope, right?
Yeah.
Because they're counting on their practitioner to have all the answers. And it's unfair to ask them to do that. That's why we became specialists. I wouldn't want my general practitioner doing my heart transplant.
Yeah.
So it is when we look at that, that's one of the reasons is if you're listening to these podcasts, that you're doing here, you're getting a perspective of a whole new world. Now you just have to find somebody that aligns up with that because
Yeah.
this really is going to play as much prevention as it is in terms of reversal, right? I mean,
Yeah.
we're seeing reversal, but the other part too is if we give the body what it needs early on, it doesn't have to get to the point where now it's trying to play catch up. And I
Yeah.
think the younger generation seeing that. I mean, my parents were always, I fought them to the day that they passed to, it was always, but my doctor said, and I'm like, okay, that's great. But look, do you know that there's all these, because I've always been on the alternative side,
Yeah.
it is, and not, it's, the body has a natural way of healing itself. It is shy of the resources. That's the one
Yeah.
thing when I talk about whether you're doing exosomes, PRP, you're doing any of these type of therapies, what you're doing is you're supplementing back to the body what it's missing. Your DNA, your roadmap is already there. It just
Yeah.
doesn't have the raw materials. It'd be like somebody coming in here with the architecture plans to tell you to build the house, but then Lowe's drops off of 50% of materials. You're just kind of looking at it and going, well, I'll put the foundation in and I'll throw the walls up, but we don't have the drywall, the electricity, so it's not going to be livable.
Yeah.
So at this point, what we want to do is supplement enough back into the body so that it has all the materials. And that's why not one therapy does it all. Why doing a combination? Because they're acting on different parts of the body. Like when you're doing red light, you're working on cellular energy. When you're doing peptides, you're working on oxidative stress. You're working on mitochondrial support. You're working on, I mean, there's all types of different growth hormone release. It
Mm-hmm.
is when you're doing stem cells or stem cell derivative type products. You're basically supplementing back in these raw materials that the body can make proteins from or calm the immune system. So it is so to say that one does it all, no, but it doesn't have to cost you an ungodly amount of money to do this. And that's why I encourage people to start sooner than later. Even if it's something as small as doing peptides and red light therapy and then working your way into it, aging is inevitable. One day
Yeah.
you're gonna need the exosomes and the other biologic products. But hey, if you could head it off, and I think that's the signal or the message that we're trying to make to the medical community is first line defense. Can we use this as a first line defense before you have to get to medicine, before you have to get to surgery? Sometimes it doesn't mean that you're going to avoid it. It just means that you're going to push it off for another 10 or 20 years. And
Yeah.
I used
Well,
to give the best. Yeah, go ahead.
also it allows you to recover faster.
Oh,
So,
absolutely.
my best friend had a genetic liver condition, and at 13, they're like, "Oh, you're going to need liver transplant in a year." And they told her this every year. She didn't end up needing it until she was in her early 30s.
Yep.
But then, unfortunately, I don't think the care was as good as it could have been
Hmm.
because she aged like 30 years in
Oh
it,
yeah. Oh yeah.
and she's having to come back from that. And it's like,
Yes.
and she took very good care of herself. She was very health conscious, which I think is how she was able to push it off so
Correct.
far. And her recovery, she had a blockage. They had to go in and open her back up.
Mm,
Her spleen
yeah.
was oversized, so they cut it off too much and then it died and they had to go in and
Yep.
remove it. And her recovery was very long, very painful. She didn't have energy for 2 years, and she had
Hmm.
3 kids, 3 and under, and from adoption. um
Yes. Yes. Yeah.
and
Yeah.
which is a huge blessing, but like,
Oh,
poor woman was exhausted,
yes.
and she's having to do so much more to come back from it, when it's like, if they could have been doing, if Mayo had been willing to let her
Right.
do these regenerative therapies beforehand and then after, to
Correct.
help the body heal, like, these peptides could have helped the cells regenerate faster and given them what they need. And IV therapy, when she couldn't eat, would have been very
Yes.
beneficial for her cells. And it's I'm looking forward to the day that all medicine is integrative medicine
Yes.
and
Yes.
medicine is prevention based instead of reaction based. I think that's
Correct.
our goal on this integrated
Correct.
side. Is we don't want allopathic medicine to go away. We don't want pharmaceuticals to go away. We just want them used
No,
in
we
the
don't.
proper place.
That's exactly right. That I wouldn't be here if it wasn't for surgery. I wouldn't be
Yeah.
here if it weren't for certain pharmaceuticals. But did it have to be my first line defense? No. As a matter of
Yeah.
fact, if I would have known about the genetic disposition, could I have done some things that would have kept that gene from expressing abnormally? There's a
Yeah.
whole research on epigenetics, and how genes are talking and, what they're communicating. Mine just didn't create a protein properly. So it was missing 3 amino acids and therefore the body couldn't use it. So when it's not being used, what it had an effect on couldn't be optimized. And so it just started to fail.
Yeah.
And so, and that's, and but you know what? Out of tragedy comes opportunity, right? So, I
Yeah.
mean, in this is that if you'd have asked me 10 years ago if I'd be walking down the regenerative medicine path, I would have said, no, like I'm having this great life. Just,
Yeah.
it is. And then sometimes you're like, man, when you pray for something, you better listen because, sometimes God just turns the wheel quick.
Yeah. Right. Let me put you through the washing machine so I'm your
That's
God.
right.
I'm the one that sustains you. I went through that a couple of years ago, and
Yes.
oh, that was a year and a half of a doozy. Yeah,
But
I
it sets you up
so
to care for somebody else. And that's the
yeah.
best part. I couldn't do what I do today had I not been through my own tragedy. And I don't say tragedy with any negative. It's that it was the thing that had to trip up in order to get you to look up.
Yeah.
So it is,
And what a blessing it is to make it your mission to help others rise up out of chronic illness and into
uh,
vibrant, thriving health. Like, that's just so incredible. And I absolutely love what you are doing. And I'm so excited to see what comes out of it in the next few years. And, just the options that people have for chronic illness is growing. And I'm just so grateful
yes,
for people bringing it to the market. And, your 18 years in the allopathic world is now you're able, the speed, have
correct,
the connections to say, hey,
correct.
there's more tools. And that's just,
Yes,
you and I are the boots on the ground,
correct, correct.
helping to make this world more integrative.
That's right. And there is more alignment happening today than ever before. And so this is becoming mainstream. And I love it. And we need your listeners to go out there and talk about it till they're blue in the face because that's how we create the change, right? We
Yeah.
rise up as a community in order to start asking the right questions, that start sparking the right thoughts that lead to the new innovations. And, we're leading new innovations just because we've looked at what's worked. It's gotten us to a point, and now we're like, how do we take it further? How do we take
Yeah.
it even further than that? and so it's constantly questioning. So questions are a good thing.
Awesome. Well, thank you so much for your time and
Oh, I
your
appreciate it, Marian.
expertise and, letting people know that there are more options out there. I think that that's just the best thing. And that's what I want to shout from the rooftops is the foundations plus the options. And
Yes.
I'm just so grateful for your time.
Well, thank you. Hey, look, I appreciate you. I appreciate your listeners because, like I said, we're all in this together. So, I should say something corny like, let's all rise up.
Yes, you should.
But I'm not going to.
So if people wanted to connect with you, learn more about the therapies, how do they find you?
Yeah, so we have a website called www.riseupmedical.com, and Rise is spelt with a Z. Again, kind of an elevated platform.
Yeah.
And so there's a lot of educational resources that are on the website as well. There's also opportunities in order to connect, where we could set up appointments and stuff like that. And then at the same time, we're very connected to the medical community. So a lot of times people are just going, hey, do you know somebody that might be able to help me? And so we're happy. And a lot of times too, if they ever reach out, they can go through info@riseupmedical.com, and we'll always get a response from us in that fashion.
Awesome. Thank you so much
Yes.
again.
You are so welcome. Thank you. No, I appreciate it.
Mark and I covered a lot in today's conversation. I cannot wait to have him back and dive deeper into these therapies individually. If you are in the thick of symptoms and want to nail down your diet and lifestyle so you can take advantage of these regenerative therapies and get the most bang for your buck, my online coaching program, the Therapeutic Food Framework, will guide you on exactly what you need to do to fuel your body well. I have meal plans with simple and flavorful meals, lifestyle guidance, plus coaching sessions with me to help you navigate how to incorporate these changes into your current lifestyle with ease, where the shortcuts are and if needed, what to focus on first before moving on to more. There's more information available on my website, and I'll have the link for you in the show notes. Thank you so much for hanging out with me today. If you found this episode helpful, would you do me a favor and help others find it by leaving a review, sharing a screenshot on social media, or sharing the link with a friend? By you sharing what you've learned, others are able to find this podcast and join our community. Be sure to check out my website, www.roadtolivinghole.com, for over 160 delicious recipes, a variety of meal plans, and a blog packed full of even more healthy living tips. If you'd like to learn more about how to work with me as your coach, you can schedule a free consult through www.roadtolivinghole.com/health-coaching/. Until next time, friend. Bye.